Hi, my name is Rayyan. I'm a PhD student at Imperial, and I'm interested in how drugs, such as illicit drugs, can help people suffering with psychiatric and neurological disorders.
So there are a lot of warnings and fears around the use of drugs. What are some of the dangers of using drugs?
I'd start by saying that drug use is never 100% safe at all. And the danger is sort of dependent on different factors, such as the drug and the set and also the setting. So different drugs have different dangers. Too much of a sedative drug, for example, can lead to fatal overdoses. And we see that with heroin. And too much of a stimulant, such as cocaine or crack cocaine, can lead to changes in blood pressure, which can lead to heart attacks and anxiety. But as well as a drug, how much of a drug is also quite important. The quicker and the more you consume of something, the more likely you are to experience some bad effects. Another important thing is how you take drugs as well. If you choose to inject a drug like heroin, there are risks with getting infectious diseases like HIV or hepatitis. So overall, I'd say it's sort of a varied thing, and there are lots of dangers to think about if you're choosing to take drugs.
So when we're thinking about the drug or the substance itself, how safe are street drugs in the UK?
It's hard to say how safe any drug is, because all drugs that you get from the street are very different. And that's because they don't go through a regulated framework like pharmaceutical drugs that you can get in a hospital. We do know from monitoring drugs over time that there's impurities in drugs, and these can be separated into two things. So we have on one side things called adulterants, and adulterants basically mimic the effect of drugs. For example, in amphetamines, which is a stimulant, we often see caffeine put inside there, which is to mimic the stimulating effects. And then you also have things which we call dilutants, which bulk out the substance. A lot of the times where we see these impurities in drugs, it's related to profit, as criminal enterprises and street dealers want to maximize their produce and maximize their revenue. And an unregulated market has led to considerable impurities in the drugs that we get from the street. So we can say, depending on different drugs, we have different levels of purities. We know that amphetamines are the least pure. They're only about 5% pure. Cocaine is about 45 to 50% pure. Overall, I'd say drugs are variable in their purity. We can't necessarily say for certain how pure anything is in an unregulated market.
And when we're talking about purity, does pure equate to something being safe?
Never. So something that is pure, such as heroin, for example, a pure heroin or pure cocaine in high enough percentages can actually be quite damaging, because individuals who are used to having, as I mentioned before, substances which have been cut with bulking agents will have more of a substance and to get an effect.
So essentially, people in the UK are going to really struggle to know what is in their drug. What is the advice if you're taking drugs when you don't know how pure a drug is?
It's always a policy of start low and go slow. So by having a really small dose and testing it and seeing how that affects you. And also, there are many drug testing kits available that you can buy commercially online, and they're legal to purchase. You can buy these through charities such as The Loop or through the Drug Science website, and they'll give you an indication of what exactly you're taking. It's all about doing your research if you choose to make the decision to take drugs. And a massive part of harm reduction is to be educated and informed in what you're putting in your body.
And what are the specific dangers of teenage drug use?
A really important part of you developing into an adult with good reasoning and good cognition and good executive skills is the maturing of the front part of your brain, and we call that the frontal cortex. That develops in teenage years, and any sort of drug that you take during that very crucial point in brain development can have negative impacts, which can stretch into later life. So you could be at higher risk of developing some neurological diseases or psychiatric diseases if you use a lot of drugs during that period.
And we've talked a bit about the issues with I suppose, the purity of the substance itself, the drug. But what causes people to react differently to the same drug? What else is going on there?
There's different ways that the body itself can break down the drugs, and that's sort of related to genes. So in the liver, which is like the home of breaking down anything toxic that goes into your body, you have a series of enzymes, and these enzymes make the big drug that you ingest into smaller, more manageable chunks to enter your bloodstream, cross into the brain and have an effect. And depending on the type of enzyme you have, that process can be very quick or a normal pace or slow. And we call those ultra fast, normal or slow metabolizers. And so the metabolism speed that you have will depend on how quickly you can feel effects or how quick the onset is. So that's an important factor, which is beyond our conscious control. And you have to do quite complicated genetic testing to find out which one you are.
I've read a few articles about people being adversely affected by MDMA. Why is that?
We do know that over the last few years that there's been around a 4-fold increase in females going to emergency departments after taking MDMA. And we think the reason why this might be is perhaps because of the role of estrogen. So estrogen is a hormone and it's commonly found in higher amounts in females, although there is a spectrum across females and males of how much you have of this hormone. And so the theory is that MDMA causes the body to hold on to water, and then the added effect of estrogen causes it to hold on to even more water. And so what happens is overhydration of the body. The result of this, unfortunately, is that it causes a lot of swelling, and it particularly causes brain swelling, and that leads to brain damage and eventually can lead to cardiac arrest and individuals dying in the most serious circumstances.
So given the fact that we don't really know what our drugs are cut with in the UK and how our bodies will metabolize the drugs that we're taking, is it possible to take drugs safely? And if people are going to take drugs, I guess, how can they reduce the risk of harm to themselves?
I think the most important things to think about if you are going to do it is to be taking it with your friends and people you trust, to make sure that you've done your research on the dosage that you're taking in relation to your body size and your gender. So if you go on Drug Science's website, we have a list of all recreational drugs, and we have sections where we have very specific information related to drugs and how to reduce harm. I would also recommend testing kits as well that you can purchase online. Starting low, going slow is key with dosing, and making sure you allow your body to respond before taking more. Know your limits and be careful, and be around people that you trust. And I'm not personally condoning any sort of drug taking myself, but just have your wits about you and be sensible, because they do have potential to cause serious harm, especially to young people.